One difference that I see in a clinician and a student is that clinician is someone who aims for perfection in one topic, while student touches upon 100 different topics, completing them to write an exam but not knowing any of them that thoroughly. So, to overcome this, let me help you with this Listen Once and Never Forget video series. Hello everyone, I am Trupti, MB medical student at Bangalore Medical College and Research Institute. As I told you in the overview video, I'll be making videos on the RS series one by one in the order that I mentioned. First, starting with the external nose. Basic terms like root or bridge of the nose, dorsum of nose, tip of nose, here the side of nose and the ala of nose. The opening is called as the nostril. We all know that. Next, coming to the anatomy of external nose, it has a osteocartilaginous framework that is covered by skin and muscles. The osteocartilaginous framework is made up of bones in the upper one third and cartilages in the lower two third. The bones present are the nasal bone, frontal process of maxilla, and the nasal process of frontal bone. The cartilages are as follows. There are three paired cartilages: the upper lateral cartilage, the sesamoid cartilages, and the lower lateral cartilage. The unpaired cartilage present is the septal cartilage. The lower lateral cartilage is U-shaped and has a lateral crus and a medial crus. Also, there is a lot of fibrofatty tissue present in this area. Next, coming to the skin that covers the external nose. It is thin and freely mobile in the upper part where it covers the nasal bones and the upper lateral cartilage, whereas the skin that covers the alar cartilages is thick and adherent. This skin also is abundant in sebaceous glands, which reminds me of a tumor called rhinophyma or potato tumor. This tumor is due to the hypertrophy of sebaceous glands present here, which I'll be elaborating on later on. There are various muscles also present in this area. Coming to the diseases of external nose, which I'll be telling in three headings: cellulitis, nasal deformities, and tumors. Cellulitis is an inflammatory condition where the nose becomes swollen and red. This is usually due to gram-positive bacteria like staphylococci or streptococci. In nasal deformities, the nose may be of saddle shape or might have a supra-tip depression or can be a humped nose. In crooked nose, the dorsum is not straight, but the bridge and the tip of the nose are in the same line. Whereas in deviated nose, the tip and dorsum of the nose are not aligned with the root of the nose. Coming to tumors of external nose, they can be of three major categories: congenital, benign, or malignant. In congenital tumors, we have dermoid cyst, which can be of various anatomical locations. It can be just beneath the skin or may go into the cranial cavity extended like this. There are other tumors like encephalocele and glioma and meningoencephalocele. These are basically skull-based defects. In encephalocele, this is not connected to the cranial cavity. The mass or the substances can be transilluminated, and whereas in glioma it cannot be. This is smooth, glistening, fluid filled like whereas glioma is hard and firm on palpation. The encephalocele can be of various varieties like nasofrontal, nasoethmoid, and nasoorbital varieties. And glioma, the most common site is extranasal. It can also be intranasal in 30% cases or mixed in 10% cases. Coming to the benign tumors, rhinophyma or potato tumor due to the hypertrophy of sebaceous glands. It is associated with acne rosacea and it is more common in men past the middle age. Other benign tumors are pigmented nevus hemangioma, seborrheic keratosis, neurofibroma, and sweat gland tumor. Whereas malignant tumors, the most common one is basal cell cancer or rodent ulcer, squamous cell cancer or epithelioma, and the least common is melanoma. Next, coming to the internal nose, it has majorly two parts, the vestibule, which is skin lined, and the nasal cavity proper, which is mucosa lined. In this video, I'll be telling about vestibule. The vestibule is covered by stratified squamous keratinizing epithelium. It has hair called vibrissae and also contains sweat glands and sebaceous glands. It is important to know the boundaries of internal nasal valve, medially bounded by the nasal septum, laterally by the inferior turbinate, and in the base by floor of nose, and in the upper part it has the lower border of upper lateral cartilage. The angle present here is very narrow, like only 10 to 15 degrees, so even a mild blockage in this area can lead to significant breathing problems in the patient. Diseases of vestibule, furuncle or boil. This is due to Staphylococcus aureus affecting the hair follicle. Next, vestibulitis, inflammation of the skin of vestibule, as you can see here. In acute vestibulitis, the vestibule appears red and swollen, whereas in chronic vestibulitis, there may be scarring and fissures present. In stenosis and atresia of nares, the nostril is completely or incompletely closed. The cause may be due to accidental or surgical trauma, or it can also be a congenital anomaly. Coming to tumors of nose, there is nasoalveolar cyst, papilloma or wart, which may be single or multiple. They may require surgical excision under local anesthesia. A malignant tumor, that is squamous cell carcinoma, may also be a disease in vestibule. This is an operation showing removal of nasoalveolar cyst by sublabial approach, leaving the vestibular skin. In subsequent videos, I'll be telling about the lateral wall of nose, medial wall or septum of nose, floor and roof of the nose. Thank you for watching.